Good morning, everyone. I welcome to today's session on the topic Decoding Tests through Ayurveda. Without further delay, I would call upon Dr. Muralidhara Sharma sir, Professor Emeritus, SDMCA Udupi, to take over the session. Welcome to you, sir.
Okay. Now, I think I'm audible now. Yes, sir.
Yes, sir.
Okay. Now we will continue with the next issue. The next issue is about the tests done to identify the microorganisms. In case of infective disorders, it's quite important to identify the organism as well as to know whether the organism is sensitive to a specific antibiotic or not. So, culture and sensitivity test is one of the common investigations done in case of infective disorder. The basics of this would be like you need to have a product of infection. It could be any tissue, any secretion of the body, pus, or so on, where the infection is located, and that is applied over the agar-gel medium as a primary culture. And once these culture organisms grow over the area in a significant number, the colonies of these are separated and they are inserted on a secondary dish. In the secondary dish, you will have the discs of different varieties of the antibiotics. So as the growth occurs and in the medium and the zone of clearance around the disc is identified. Like if there is a specific antibiotic which would be sensitive to that particular organism, around that disc there will be an area of a clearance. There you will see the color changes. Right? Where organisms grow, there will be a different color. And based upon the width of this circle of clearance, zone of clearance, you'll confirm whether the organism is sensitive to that antibiotic or not. So each of these discs would have some blotting paper which is dipped in a specific antibiotic and they are coded. Now, in this disc asset, you can see the area of a zone of clearance to a maximum extent with this disc, whereas virtually no clearance around this disc. So we can say that the antibiotic which is present in this disc is really sensitive to that organism and the antibiotic is resistant. So this way, culture and sensitivity test is done to confirm identification of the organism as well as whether that organism is sensitive to a specific antibiotic or not. So it has a therapeutic value. But one of the basic problem would be the whole of this process takes about minimum of 2 days, minimum of 48 hours to get this result. So in a patient with an acute infective disorder, whether to treat that patient blindly with a specific antibiotic or select an antibiotic only after the culture and sensitivity test, these are all the big questions where you may not have a definite answer. Identification of the organism is based upon their shapes of the colonies. Now, in addition to this, another level of investigations which are done would be in the filter tests. In the filter test, the inhibition concentration of the organisms to antibiotic also can be made out. Like, see, in this case, the culture, the primary culture and the sensitivity test, all that you can say that the organism is sensitive to the antibiotic or not. But in the next level of the filtration test, you can even make out like what would be the concentration of that antibiotic required to inhibit the growth of the organism, where you will be trying the culture over solutions of antibiotic at different concentrations and hence come to a conclusion. Now, whether that concentration is biologically feasible or not. Suppose an antibiotic is sensitive to an organism in a very high concentration, which cannot be achieved in a human body, even if you have done the culture sensitivity test and it has become positive, it may not be practically feasible. So, the resistance of organism to antibiotic can be made out. Anyway, that's about the basics of the microbiology. Of course, from Ayurvedic point of view, we do not consider the organism as responsible for the disease, but organisms which are present in the body could be considered as a consequence of the pathology which is present in the body. And Sushruta has considered all those diseases which are produced with the organism as the Vishama Jwara. Vishama Jwara is that's how treatment these diseases have to be considered. And Ayurvedic treatment will not be against a specific organism, it will be based upon the dosha dusha lakshana as such. And hence, there is a limit to the investigations of identifying the organisms when we plan for a Ayurvedic treatment. But knowledge of this is quite essential to predict the prognosis and course of the disease. Of course, a bit high level, we will not go much into the detail. Suppose an organism is not really identifiable, it cannot be separated. In that condition, you may have different other techniques to identify. In the microscopic technique, again, you'll have many modifications like a bright field, dark field, etc., by which the organism which otherwise cannot be identified can be identified. Of course, there are staining methods also. The most popular is a gram stain, gram positive and gram negative. That's how it's classified. Or different varieties of the staining procedures also can help you to identify the organisms. Even if it's not possible, then there are lots of biochemical techniques as well as molecular techniques. Among them, one which is now quite popular is a polymerase chain reaction or PCR test. PCR is a confirmation of that the organism is multiplying in the body and the DNAs of that particular organism is identified, and that's how you can confirm the origin of the antibiotic, this organism. If the organism cannot be identified, then there would be lots of other tests done by which the chemical property of the organism can be identified, and these are the series of tests which are not really done in the regular practice. In the regular practice, these are not done only in case of one specific organism which otherwise is not identified. Then to identify the nature of the organism, or what we call as the novel organism, these are the tests done. So we will not go much into that. So that's about one of the type of clinical investigations done in the clinical practice. Now, another area which is now coming up, and it's not yet very common, but it's maybe in the future it may be quite common, would be the DNA study and gene mapping. At present, this kind of investigations are limited to a few of the genetic disorders like hemophilia, etc. They can be identified better. Chances of a congenital development, a congenital abnormality in a fetus, that can be identified, so on. So that's about the advanced stage. In the routine clinical practice, DNA gene mapping are not done regularly for the routine clinical conditions. Of course, maybe possibly in due course of time, these genes and the DNA mapping could be of some use to identify the Prakriti, question mark. Of course, it's not yet popular. There are many studies done. Many studies are published about a relationship between this genetic mapping and the Prakriti. But at present, it's not a feasible one. It's not in a level where it can be practically applied. Maybe in future, it may be possible. So that's about the genetics as such. Now, that's about one set of the investigations which are related to the clinical practice. Now, another set of the clinical practice investigations would be to study the morphology of the cells, microscopic studies where the morphology of the cells are studied, and by studying the shape and alignment of the cells, there could be a identification of the disease. The characteristic of a tumor pathology in the tumor, particularly the malignant tumor, the definition of the tumor itself is having a atypical cell. Atypical cell means where the size of the organism, size of the cell, as well as the age of the cell is not typical. That's exactly what Charaka has said as a Prithunam Samshiptatum or Samshiptanam Prithuta. Prithu and the size being abnormal or variant, that can be identified by the microorganism. Now, this microscope, to collect the cells from the body, there are many techniques which are done. The commonest technique and simplest, least invasive technique is exfoliative cytology. Exfoliative cytology is the cells which are present from the secretions of the body. Either it could be a spontaneous secretion like the pus or discharges, or you may just wash the cells tissue with saline, and then that washed substance is collected, and then it could be studied under microscope. Like now, when I say spontaneous in the sense commonly done in case of ascites, a patient presenting with ascites fluid, that fluid could be studied under the microscope, or you may just wash the stomach in case of the endoscope, gastric pathology, instead of taking a biopsy with that endoscope, you may just insert saline and then wash up that, and this could be used for study. Or the smear could be just taken from coming into contact with the tissue without really injuring the tissue, as in case of the pap smear, Papa-Nicolau smear, so on. So now, with this, the information which you get would be like whether the type of the cell would be of a different degree of malignancy. Now, I have given a sample of a pap smear, Papa-Nicolau smear. In the normal cells, the cells would be of same age, same size as it. But in case of malignant cells, the malignant cells will be having more of a nucleic acid, and hence they take more basic stain, and their shape would be abnormal. The grade of malignancy is identified by what we call as the mitotic figure. The cells which undergo at different stages of the mitosis, they are identified by the shape of the nucleus at the stages of mitosis. Mitosis, I think you know about that stages of the mitosis. Like initially, the cell nucleus would be just increasing in size, and then the nucleus becomes binucleated, and based upon that, we name them with metaphase, anaphase, telophase, and so on. The different names are given based upon the shape of this nucleus. And in normal situation, the number of cells which are in the active mitosis, where the nucleus shapes are altered, would be less than 12, but less than 12 per 100 cells counted. Now, in case of neoplasm, this number can increase. Now, depending upon that increase in the number, you may grade the malignancy as low-grade malignancy. Now, as in this first smear, you can see some of the normal cells where the dye is still reddish in color, whereas the abnormal cells, and with the abnormal cells with the abnormal shapes of the nuclei which are in the telophase end stage where the nucleus is almost bifurcated, and some of those in the metaphase or prophase where the nucleus is just swollen, and based upon that, you can make out like this a malignancy, and comparatively to the second slide, this picture, where the number of cells of that sort are quite high, mitotic figure is quite high, and hence that's how you grade the malignancy. So whenever you send a tissue for the study, that study gives you a report like whether it's a low-grade malignancy or high-grade malignancy, and that can be better made out with the simple smear study. And whatever our Samhita says about the different varieties of the pradhara, like the yonidoshas, these can be better made out. Like, of course, this kind of different prognosis is mentioned in our text also. But there it was based upon only the smell and consistency of the discharge. When there is a durgandha, pichila, or vidagdha as such, that would be suggestive of a poor prognosis. Or when the discharge is quite thick, like sarpil maja vasopama, that would be still more poorer prognosis. Or even it could be based upon simply the quantity of the fluid. When there is a excess of bleeding, that also could be considered as asadhya. But when we use these smear studies, the findings will be more accurate. So simply depending upon the clinical criteria, also it is possible, but these histopathological studies would give you a better and more accurate information, and hence they are more reliable, and they support to the prognosis predicted in Ayurvedic text as such. Now, to continue with this histopathology, now in the exfoliative cytology, you do not injure the tissue, whereas a technique where the tissue is injured and a sample is taken for the study is a FNAC, or fine needle aspiration cytology. This is done in case of a suspected tumors or masses where the content of the tissue is somewhat softer. So you insert a needle, suck the tissue, and that tissue which is present in the needle, that could be studied under the microscope. Technique and observation would be the same, so you can confirm whether the tissue is malignant or benign and so on. So that's the one. But this FNAC, you take a very small tissue as such, and there is a possibility of error. So in such cases where FNAC may not be very reliable, or the mass is quite hard, and the needle aspiration may not be possible. In that condition, you'd say excision biopsy, where the tissue is cut off, made an incision, and then tissue is cut up, and then it is studied under the microscope. Again, the observation will be of the same. So when you send a tissue for the histopathology, the whole observation is based upon what you observe in the microscope, and their shape and the function of the shape and the staining property of the cells and alignment of the cells is the criteria by which you can make the diagnosis. Of course, in the present day situation, there are still more some advanced technology. It's not only the shape studies, it will also be studying the chemical property of the tissue which is collected, which you call as the immunohistochemistry or IHC, where the immunological property of the substances present in the tissue that can be studied, and by which you may have more accurate information about the prediction of the prognosis. So in case of the tumor pathologies, when we make use of these tools of either simple histopathology or immunohistochemistry, the information we get would be about the nature of the tumor and possible prediction of the prognosis, or at times even it helps in selection of the right choice of the treatment when it comes to the question of chemotherapy or radiation. Now, this idea of identifying the consistency of the tissue is not new to Ayurveda. Sushruta has clearly described about the Ara Shastra, and the Ara Shastra is used to confirm whether a lesion is Ama or Pakvavastha. The Ara Shastra is exactly similar like that of what we call as a liver biopsy needle, where there would be a needle and which can just expand, and or maybe a boat-shaped needle which is inserted into the tumor or mass, and then the tissue is collected. Only the difference is Sushruta didn't have a microscope, and hence he doesn't mention about the microscopic study. It would be only the examination of the substance which is collected by the naked eye and then confirm whether it's a Ama or Pakva. So I don't say that the concept of Ara Shastra mentioned in Sushruta about Ama Pakva Parishana is as advanced as the current histopathology, but the seeds of the histopathology were present even in the Samhita period also. Now that's about one set of the investigations. Now, so microscopic studies. So we'll come to the end of the one chapter there. Now, next set of the investigations would be to enhance the capacity of visualization. For the visualization, there are basically two varieties of the techniques which are used. One is endoscopes. Now, endoscopes are the fiber optic tools by which a light can be really bent, and hence, so that's the idea. To make it simpler, you will have a fiber optic technology, and the fiber optic technology is simply having an alignment of multiple reflectors across a tube, and hence the light is reflected in very small microscopic mirrors, and hence the light virtually can be converted into a bent one. So development of these endoscopes has resulted in a revolutionary approach where any of the organ in the body can be studied. Based upon the area or the organ studied, the instrument could be named with the different names as such. So you'll have an innumerable number of instruments, like proctoscopes are the oldest and simplest, where the extension of your vision could be enhanced by inserting the instrument into the rectum. Esophagoscope, where the esophagus could be seen. Gastroscope, where the intestines, stomach is seen, and so on. Laparoscope for the abdominal cavity, and now you will have in the arthroscope, cystoscope, and so on. So different types of the scopes are used, where the basic technology is the same, the fiber optic technology. The only difference is the dimensions and the other properties, physical property of the instrument, which would be suitable for that particular organ. Like to enter into the stomach, you need some specific length, specific diameter, or for the abdomen, you need again a specific diameter. Based upon that, or to enter into the salivary gland, you need a specific diameter. So based upon that, the instruments are named and instruments are designed. So that's the basics of the endoscopes. Whereas the other way of visualizing would be by imaging techniques. Different sorts of imaging techniques are used, plain X-ray, CT, MRI, or PET scan, USG, radionuclide, and so on. We will have some examples of these in the coming discussion as such. Now, the commonest one which we use regularly is the gastroscope. In our hospital, you might have seen that. The gastroscopy, you can see the interior and you can identify certain variety of the lesions. From the current the diagnosis point of view, when there is an inflammation and erosion, we make a single diagnosis of gastritis. But gastritis also can be, it can be that endoscope also can be quite useful to make out or plan the Ayurvedic treatment. Now, when a gastritis is presented with the superficial erosions and in the stomach, multiple small ulcers, that's the typical feature which is seen in a typical gastric ulcer, where the pain would be more even in the empty stomach. The patient would not be able to tolerate the food. Nirahara sesiva tigram shulam udiriyate. Even the nirahara condition, there will be pain. And in that condition, what we see is usually what we call as erosive gastritis. Multiple erosions are seen in the area, quite commonly in the antral area, antrum or prepyloric area. And this is typical of the Vataja Shula. And the usual preference of the treatment in that condition will be Agnitundi or Avipattigara Churna. That's how we prefer to treat that condition. Whereas, if there is a deeper ulcer, peptic ulcer, and ulcers are deeper, and you see a slough material, or what we call as the H. pylori infection. In case of the duodenum, we will see the ending of the membrane as rough membrane-like lesions. Then there the patient would have more of burning sensation or at times vomiting. Pitta lakshanas are commonly seen in that condition. And these are typically of the Pittaja Shula lakshanas. In the Pittaja Shula, the features which are mentioned are exactly Trishna, Dahaha, Mada, Murcha, Tivra Shulam Jayate, Shita Bikamaha. Characteristically in these patients, the consumption of milk would be reducing the symptoms, and this is the typical feature of what we see in case of deep peptic ulcer seen under the endoscope. And the usual treatment in that condition would be Sudhshekara Kamadaga, either Bunimbadi or Avipattigara, depending upon the other presentation. So Pitta Shamaka Chikitsa is the usual treatment. So important is endoscopes can help you to more accurately make out the dosha vitiation in case of the gastric pathology. That's all the point. Vataja or Pittaja or the Kaphaja. Kaphaja is commonly seen in case of atrophic gastritis. Comparatively, incidence of atrophic gastritis are lesser than the other, and in this characteristic clinical feature would be the reduced appetite and a flatulence. Patient would always have a feeling of flatulence, where even occasionally there could be excess of salivation. So ativa purna kostatvam, where the patient would have a heaviness in the abdomen and hlasa, the salivation. These are the features in case of the atrophic gastritis, which is obviously a Kaphaja variety. And in that condition, we can select a treatment of the Kapadana Aushadhi, which commonly used is Chitrakadi or Kumari Asura, etc. These are how the treatment could be done as such. Whereas in case of malignancy, tumor pathologies, again, clinical symptoms can vary quite significantly, but very important are weight loss, anemia, and severe impairment of the appetite. Now, the Krushaha, Panduhu, Shushyati, these are all the typical features of the Dushi Udara, and prognosis is poor. Of course, we may not suggest, I don't suggest any specific treatment from our point of view. We can make out that it is a Asadhya Vyadhi, and then, of course, the approach would be as usual from the clinical interest point of view and from the safety point of view. The patient has to be referred to a hospital or some other center. Only when the patient is not ready to go somewhere, then you may plan a treatment, but obviously the prognosis is poor in that condition. So gastroscopy can help you to make out these stages of the Shula and the Udara condition as such. Important is the idea of a tube being used to visualize the lesion is not again a new thing. Sushruta has described the Nadi Yantra. Nadi Yantra is a tubular instrument which is used for identifying the lesions at an area which is beyond the reach of the eyes. But primarily, the instruments which were used in Susura's period were rigid instruments, and hence the scope was lesser. So it was limited to the rectum or anus, or Vagbhata has extended that by having a tube which would be even visualizing the internal area of the neck. So, and that's a primitive esophagoscope. Esophagoscope used till very recently were rigid tubes. That fiber optic technology has come up quite recently, and that's the Antakantha Shalyavalokini. That's the basic idea. Now, important is Sushruta has devised or had an idea of having a tubular instrument with a source of light to identify a lesion which is beyond the scope of the eye 5,000 years back. But if you go into the Western history, the first of the endoscope was used in 1806. The credit goes to Philip Bossini. And then, of course, and that was a simple rigid tube with a light on one end. Then, of course, all the technology has developed. So, from the history point of view, the history of the instruments used to visualize the lesion, the credit should go to Sushruta. Now, that's about one thing. Now, we will not go beyond that about the endoscopes, fiber optic endoscopes. They could be of innumerable variety. Now, coming to the other imaging studies, the one commonly used is the plain X-ray. The plain X-ray example would be of different varieties of the lesions. Fracture, of course, I think most of you are aware of that, seen these kinds of the lesions. Suppose a patient has come to you with a clinical signs of the abnormalities or injuries, and then the visible abnormality. To confirm, you may get a X-ray of that patient, that part. Of course, we'll not go into the history of the X-rays and so on, but it will be practically useful to make an Ayurvedic diagnosis even, whether there is a Bhagna or not, whether it is a Bhagna or Sandhimukta. The types of the Bhagna mentioned by Sushruta, the 14 types of the Bhagna mentioned by Sushruta, where the shapes of that fracture line are mentioned, and they can be confirmed with the X-ray as such. So that's one thing. Or even the collection of the fluid, presence of the fluid in the chest, as in case of the Urakshata, where the Kshate, Urasi Kshate Raktam Puyah Shleshma Vagachari. Sushruta has clearly mentioned that there could be a fluid which could be either blood or the pus or any other source of the fluid which is present, accumulated in the chest. That accumulation of the fluid in the chest can be confirmed by the chest X-ray, or maybe more accurately made by the ultrasonography. Of course, ultrasonography is more dependable tool to confirm whether there is a fluid accumulated anywhere or not. So any of such collection of the fluid can be better made out with ultrasonography or with the chest X-ray also. In case of the Uras, the chest, it can be made out by looking at the obliteration of the cardiophrenic angle. Whenever there is a fluid in the pleural space, it will be in the gravitational dependent area, and hence the chest X-ray can be useful to make an Ayurvedic diagnosis of Urakshata as such. Or in case of Nadi Vranas, to identify the Nadi Vrana, Sushruta had used the Yeshani Shastras. Yeshanis are probes which are used, and these probes could be inserted through one opening, and then it may pass through the path of least resistance. And when you see the path of least resistance, that would be the means by which you can identify the extent of the track as such. Now, instead of this probing, the probing is a blind procedure, and the probing can produce some injuries even as such, or at times the probing may not be able to make out fine bifurcations or fine branches. You may have a tool of the X-rays where you inject a radio opaque dye, a substance which is opaque to the X-rays as such. So usually it's a sodium hydrothalamate, the iodine compound of the sodium, which is injected into the tract at one opening, and then as it follows through the tract, because that liquid can flow through the tract easily, much easier than a instrument like a probe. So with the instrument like a probe, it has to be pushed very carefully, whereas the fluid, it can go through that, and hence once you get an image, you can get the exactly the same impression, more accurately, more safe to the patient, whether there is another opening or not, whether there is a cavity or not. So information which you can get would be more detailed with the fistulogram. So idea of probing can be achieved more accurately with a fistulogram. So Yeshana Shastra or Yeshana Karma as such, the whole function of the Yeshana can be replaced by the investigations like fistulogram, or of course even ultrasonography also can be quite useful to make out that. Now another this modification of the X-rays would be just it's a modification is the mammography or elastography. Mammography is simply the same X-rays. The only thing is the time of exposure is increased and the intensity of the exposure is reduced, and hence the difference in the consistency of the tissues can be better made out. So a density of a fibroma or a tumor and the density of the fat tissue, that can be made out in a mammogram. So mammogram is simply an X-ray which is slightly modified, and this because of that quality of a longer exposure of a low intensity X-rays, you can make out the difference between the consistency of the fat tissue and the tumor pathologies or any other mass lesions, and based upon that we can confirm whether there is a mass otherwise or not in the breast. Now this is very specific to the breast because in the breast the issue is because it's surrounded by the fat tissue, often the palpation could be misleading, and chances of missing a mass would be more, whereas with the mammography you may not miss that mass. So that your sparshana pariksha can be more accurate with the mammography. Now elastography is another tool where the X-ray as well as ultrasonography both are combined together, so that the density of the mass which you have identified with mammography can be more accurately predicted. It's like whether it is a fibrous hard tissue or calcified tissue or maybe fat tissue, or which by the it's just an extension of the palpation. Your touch sensation is extended. So you can make out like whether it is a mrudu or kathina or sthirata, whether it is fixed to the surrounding area. These can be better made out with the elastography. So the same idea of having assessment of the consistency, mrudu or sthira or kathina, that can be better made out with the tools of either mammography or elastography. Or now that's about the plain X-rays. Of course, the same issues can be enhanced to any other area, like any other contrast X-ray, like a barium series for stomach duodenum and so on. Now, the other tool is the CT or MRI scans, or even the PET scans. CT scan is a computerized technology where the images are created, virtual images are created at different sections of the body, so that you can virtually see the areas of the body without really cutting the body. Whereas a MRI scan is making the body temporarily radioactive by keeping the body in a magnetic field, so that the emissions of the radioactivity emitted by the tissue is collected, so that consistency of the tissue can be better made out. PET scan is more advanced technology where the positron emission is specifically corrected, so that you can even assess about the functional intensity, the metabolic activity of the tissues. Those tissues which are very highly metabolic active, they will be seen as blue color, and those which are less metabolic active, they will be seen as red color, or that the range of color. By that, the metabolic activity of the tissue can be made out. Now with the plain X-ray, plain CT scan, a hemorrhage in the brain, it can be made out. Now you can see this lesion, opacity of the blood clot. Whereas the PET scan, similar lesion, the area is tissue is dead, where there is no metabolic activity. And in the surrounding area, of course, the metabolic activity is slightly varying. The cortex has a higher metabolic activity, medullary area has a lesser metabolic activity. Now, in the MRI scan, the other way, another area, where you can see the displacement of the organ, a mass which is pushing the midline, and hence there is a shift as such. Now, when a patient develops the neurological lesion, it could be due to primarily two reasons. Either that tissue could be dead, nerve tissue could be dead, or nerve tissue could be compressed. So, with the all that tools of the scans, you can confirm whether there is a death of the tissue or tissue loss, or whether there is a displacement of the tissue. Vayoho dhatukshayat kopaha margasya avaranena. So whether it's a dhatukshaya or margavarana. Dhatukshaya where the tissue is lost or dead, and margavarana where it could be displaced or compressed. This can be made out with more accurately and maybe high sensitivity with these tools of investigations of the different scans, CT or MRI. Even the other way examples could be a patient with a low backache where the spinal cord is compressed, spinal canal stenosis, where the nerve is compressed, due to nerve is compressed due to a mass expanding from the bone, a bone lesion which is pushing the area, the spinal canal. That's the margavarana. Whereas in case of sclerosis, in case of the spinal cord sclerosis, where the spinal cord seems to show, we can make out that the spinal cord shows areas of lower density and higher density. In the transverse section image also, in the spinal cord area, this spinal cord area, vertebral body and the spinal cord area. In the spinal cord area, you can see the area of high density and low density, suggestive of the tissue loss. So dhatukshaya and margavarana, that principle can be applied and more accurately made out with the CT scans or maybe any of those investigation tools as such. And we can even plan the treatment. This is what you can see in the clinics also. Patients with have the dhatukshaya lakshanas, we usually go for the brahmana chikitsa like Raja Apandasti or so on. Whereas the patients with the margavarana, we go for the Pachana chikitsa like Sharabasti or Agni chikitsa and so on. So depending upon the stages or the evidences. So these investigations of the CT or the MRI scan also could be quite useful to make out the diagnosis. Now nuclear medicine is another tool. It's actually PET scan or the other way, where a radioactive substance is administered into the body, and that radioactive substance gets concentrated in a specific tissue area depending upon its property. Now, by that, the tissue's metabolic activity can be accurately made out. Like suppose you are giving thallium, the radioactive substance, and it gets metabolized in the bone. So areas, zones of the bone where this metabolic activity is more will be emitting more scans, radioactivity, and that radioactivity can give you a darker image in those areas where there is such a lesion, and hence it can be made use of to make out the diagnosis. Like see in this bone, the tibia, there is one area of increased metabolic activity, and that increased metabolic activity suggests about a tumor pathology. And even before there is a clinical presentation, the lesion can be identified, and quite useful to identify secondaries in case of a malignancy. So the most important use of this nuclear medicine is the identification of a lesion even before there is a clinical presentation or early identification. That's the exact future. Now, early identification and a preclinical assessment of a disease also is a primarily Ayurvedic concept, though the tools are not there. You do not have such advanced tools. Sushruta has clearly described about a lesion, possible lesion, which can result in a dhatpantarastha linotpad saukshmyad na upalabhyate. A lesion can remain in the tissue, hidden in the tissue, and hence will not be seen clinically, but later it can become flare-up. So that course of the disease where it can remain hidden or remain asymptomatic for a long time and then it can flare up is known and is described by Sushruta. The only thing which we do not have is a tool to identify that at an early stage. Nuclear medicine fills the gap. Nuclear medicine fills that gap so that you can identify such lesions at an early stage and then, of course, decide about what to do as such. That's about one set of the investigations of imaging studies. Now, next set of the investigations which we use would be studying the functions of the different organs. Now, among those, the most common which is used is ECG or the echocardiography. ECG is studying the electrical activity of the heart. Echocardiography is a modified ultrasonography. It's a ultrasonography itself where the fluid movement in the heart, the blood and the movement of the heart muscles either can be collected in the form of an analog score, analog graph, where you can even measure the pressure measurements and the waves, or it could be the digital imaging where you can see the dimensions of the different chambers, thickness of the chamber, and so on. Now, by studying the electrocardiography, you can make out the electrical activity of the heart, and it's not that it's confirmed about any specific disease. So the only thing which we have to know is the specific conditions where the ECG would be useful and the conditions where the echocardiography would be useful. Echocardiography gives you a clear idea about the amount of the physical force applied by the heart as well as the dimensions of the heart chambers, like how much of the pressure is applied or not, and how much of the fluid is pumped out during every volume, whether the direction of the movement of the blood is in the proper direction or it's in the opposite direction. With that color Doppler, you can make out like when the blood moves in the proper direction, it gives a bluish color, and when it moves in the opposite direction, it gives a red color. So all that advanced information about the gati, the movement of the substances can be made out, and that's exactly what Sushruta has mentioned as chalanam achalatum achalanam chalata. The different varieties of the movements of the different structures of the body can be studied more accurately with such investigations as such. So that's about one more set of the investigations. The next set of the investigations which we study would be the total function of the different organs, which we will discuss in the next session. Today the time is over. If there are any questions, I will try to answer them, and then there are some questions like clinical significance of FNAC in hyper and hypothyroidism. Of course, you can make out like whether there is a real thyroid activity increased or not. See, a thyroid cell which is inactive would have more follicles. To understand that, you should have a clear idea about the physiology of the thyroid gland. The physiology of the thyroid gland is the thyroxine which is formed is from the basic would be combination of iodothyronine, diiodothyronine and triiodothyronine, and they will be stored in the follicles in the thyroid gland. Only when there is a stimulation from the thyroid stimulating hormone, that will be evacuated. So when there is a increased thyroid stimulating hormone, more vacuoles or more of these follicles which are within the thyroid gland will be evacuated, and hence you will see empty follicles. Whereas when the thyroid activity is lesser, thyroxine hormone is not released, these follicles will be full. So hyper or hypothyroidism, they are made out by the presence or absence of those empty these vesicles or empty follicles. More empty follicles suggests of increased activity, lesser empty follicles suggests of a lesser activity. By that, the hyper or hypothyroidism is confirmed by the FNAC. I think that's the answer for that. Then another question, in differential count, how to differentiate between bacterial, viral, and other pathology? Of course, this is a different issue. In case of any of the pyogenic infections, see, if there is a infection produced due to an organism which produces a pus-producing reaction, pyogenic reaction, there will be a more of pyogenic cells produced. Pyogenic cells are polymorphonuclear leukocytes. If the organism cannot be tackled with the pyogenic reaction, as in case of the tuberculosis, granular matrix reaction, and the defense of the body has to be by producing more of antibodies, there will be more of lymphocytosis. Viral organisms, they cannot be just tackled with the phagocytosis. So WBCs, they will not be changed. There will be virtually no change in the cell count in case of the viral infections. But with certain viral infections, the virus may damage the blood cells, and there could be hence a reduced leukocyte count. So that depends upon the typical property of the body, how it reacts with that specific organism. That's all the point. Again, the debate is about same, whether the organism is important or reaction of the body is important. See, from the current point of view, what we say is, if there is a pyogenic organism, you will have total leukocyte count, polymorphonuclear leukocyte count would be raised. But what Ayurveda would say is, because it's a pitta vyadhi, there will be more of paka, puya, and hence there will be more of the polymorphonuclear leukocyte count. In case of the tuberculosis, because it's a kapha vyadhi, and hence there will not be much of the symptoms of pitta and low-grade fever, which is kapha lakshana, you'll have lymphocytosis. So that's how it can be understood from Ayurvedic point of view. I think that's the answer for that question. Then next, what's the role of Agnitundi and Avipatikara in Vata Shula? Of course, Agnitundi is known to be Vata Shamaka, Ushna Vijayadravya, and Shita Guna of Vata is tackled. And Anulomana, in all Vata Vyadhi, Vata Shula, Anulomana is the primary treatment, and Avipatikara is given as the Anulomana. It's not that the same drug should be used. It could be any of the drug which could be having the same property of Vata Shamana and Anulomana can be used as such. Then another question, if the patient is having both Dhatuksha and Margavarana, we have to treat first Margavarana only. I think that priority will be based upon the course of the disease. In certain diseases, it could be the priority could be Margavarana, or in certain diseases, it could be Dhatuksha. But ultimately, in every condition, whether it's a Margavarana or not, at the end, there will be Dhatuksha. So when the disease will become irreversible, there will be Dhatuksha. So priority would be to the Dhatuksha than the Margavarana in general. That's a very broad statement. It may not be generalized. Then another question, what is the significance of PET scan in case of raised PSA value? So the PET is mainly about studying the metabolic activity. So whenever there is a suspicion of a benign or malignant lesion, in all malignant lesions, the PET scan would be more confirmatory to confirm about the malignant activity than the histopathology. Or for the histopathology, you will have to injure the tissue, collect the tissue. Whereas with the PET scan, you do not injure the tissue. And hence, PET scan, the major, again, of course, it's not a complete statement, but the major use of the PET scan is to differentiate between a malignant and benign activity by studying the tissue's metabolic activity. More metabolic activity is a sign of malignancy. That's a brief and simplest possible description. Of course, the detail can be but more, so it may not be a complete description for that. Then there is another question. Is there a significance of hematological investigation in patients undergoing Shodhana? I don't say that there is any specific relationship with the Shodhana and the investigation, but all the investigations are quite relevant to make the exact diagnosis of the condition and prediction of the prognosis. Prediction of the prognosis is quite vital, and the prediction of the prognosis can be better made out with the investigational tools than simply depending upon the clinical signs mentioned in our text. That's all, but I have a version. Of course, I do not go into controversies beyond that. Then another question is, in case of atopic gastritis, why can't we consider it as a Vataja? Okay, fine. So it could be Vataja or Vata Kaphaja. That is quite possible. I do not deny that part. But basically, the issue is about the clinical significance, clinical presentation. Clinical presentation of atopic gastritis usually is of a fullness in the stomach, which is typical of Kaphaja Shula as such, and reduced appetite. Whereas Vataja Shula would be having more severe pain in empty stomach. So that's how the idea of confirming this Kapoja or Vataja Shula based upon the clinical science or these gastroscopic science. Then there is another question. If a patient with raised PSA value of about to 19, which is diagnosed during health checkup and also without any symptom, prostatitis, how to understand this condition and is there a treatment necessary? See, if the PSA level is raised, it's as per the current guidelines, it's absolutely necessary to confirm whether the lesion is simply inflammatory or a tumor. In general, when it is raised above 19, most possibly it could be of a prostatitis. That's the clinical one. But prostatitis would be usually painful. When you say there is a asymptomatic patient with a raised PSA, it's absolutely necessary to confirm whether that there is a tumor pathology or not. So you may need all the other tools of investigations like ultrasonography. PET scan is only when there is a possibility, high possibility of malignancy, and to confirm whether there is a secondary in the bone, PET scan would be necessary. So the whole issue would be based upon the clinical workout. You'll have to take the history, have a detailed examination, think of the different possibilities. I think that's about almost all the questions are answered. I hope we can conclude today. Right? So,
Yes, sir. On behalf of everyone, I thank you, sir, for such an informative session.